Air 912 has just touched down at the Hiranura International Airport from Havana, Cuba, bringing 113 medical professionals to the island to aid in the fight against COVID-19.
On behalf of the government and people of Saint Lucia, as well as on behalf of the Department of Health and Wellness, it gives me great pleasure to welcome you today in solidarity. On Thursday, January 30th, during the second meeting of the Emergency Committee, convened by the World Health Organization Director General, regarding the outbreak of COVID-19 in the People's Republic of China, the committee agreed that the outbreak now meets the criteria of a public health emergency of international concern. The World Health Organization indicated that they expected further international exportation of cases to appear in any country. They advise that all countries prepare for containment, including prevention measures, active surveillance, early detection, isolation, case management, and contact tracing. Since the WHO situation report dated March 26, 2020, they've reported a total of 462,684 confirmed cases globally, with a total of 20,834 deaths, with the global risk level assessed as very high. The Department of Health and Wellness has been monitoring closely the escalation in the classification of the outbreaks, and in collaboration with all stakeholders, has strengthened systems to reduce the possible impact on our population. We have managed to keep the number of COVID-19 confirmed cases to 3 imported cases. One important gap that we recognized was that of human resource capacity in relation to healthcare workers to support the expected increases within the community respiratory clinics and the respiratory hospital. This led to us reaching out to the Cuban government for support in this regard. Saint Lucia, as part of CARICOM, is pleased with the establishment of the diplomatic ties with Cuba from the time of its independence in 1979. The contribution that the government and the people of Cuba to the development of Saint Lucia and the wider Caribbean is tremendous and not easily quantifiable. For this, we are very grateful. The world has recognized Cuba as a leader in health innovation and health education, and has undoubtedly a population with the best health status in this part of the world. Through your kindness and generosity, you've shared with Saint Lucia and the rest of the Caribbean your expertise to the training of our youth, through the dispatching of medical and other technical expertise to our islands, and through the sharing of technologies and innovative medicinal and other products. The Department of Health and Wellness, we recognize that good health and wellness are integral in the optimal functioning of all persons in the performance of their day-to-day activities, in their professional capacity, in their communities and the wider society. We believe that prevention, early diagnosis, and treatment are important and cannot be underestimated. Saint Lucia has made great strides in its goal to provide quality healthcare for all, due in large measure to continued assistance from the government and people of Cuba. They have facilitated training of over 350 professionals from 2006. We've received over 100 scholarships for training in medicine. Also received training in dentistry, agricultural science, psychology, architecture, humanities, physical education, sports, computer engineering, pharmacology, and we also had over 100 trained graduate nurses to work within our healthcare system. The government and people of Cuba have also assisted us through the provision of healthcare professionals to staff our healthcare facilities where we experience staff shortages. The medical collaboration with Cuba, called the Integrated Health Program, which commenced in June of 2006, resulted in greater than 50 nurses coming to Saint Lucia to alleviate the nursing shortage. We've also received medical specialist support in psychiatry, epidemiology, family medicine, ophthalmology, and to date, the nephrologist on island is from the Integrated Health Program with Cuba. I have to mention that in 2005, the government of Cuba commenced receiving Saint Lucians into the Miracle Eye Care Program with the goal of restoring vision free of charge for the people of Saint Lucia. Later in 2010, the government of Cuba, in collaboration with the government of Saint Lucia, established the Ophthalmology Center at the Victoria Hospital, and through this program, we've received Cuban medical doctors, nurses, and technicians. The government of Cuba has also assisted Saint Lucia in areas other than health, such as agriculture, education, infrastructure, and sports, among others. As a new chief medical officer in the Department of Health, and also a graduate of the Superior Institute of Medical Sciences in Santa Clara, I wish to provide full assurance that we will continue promoting collaboration between our two countries in the area of health and social sector. We recognize that the world is now operating in a changing economic climate, making close collaboration and sharing of resources an even more crucial priority for countries which enjoy mutually beneficial partnerships. The government of Saint Lucia, through the Ministry of Health, is looking forward to the continued collaboration and goodwill between the governments. In closing, I would like to thank the government of Cuba on behalf of the Ministry of Health and the people of Saint Lucia for your quick response in supporting us in preparation of the threat of COVID-19. We know you are faced with your own challenges to respond in country and also extending support to the rest of the world. I would also like to express sincere thanks and gratitude to the Ambassador of Cuba, His Excellency Alejandro Simancas Marin, for his assistance in facilitating our request. Thank you.
At this time, we call on our Honorable Minister of Health, Mary Isaac, to deliver some brief remarks.
I want to thank you very much, all of you, for being here with us today. I know that it has been a long journey for you because you started out since yesterday, and I want to apologize for us not being able to pick you up from yesterday, but as you know, borders are closed and we had to put a lot of logistics in place to get you here. But since you are here, let me say welcome. We are extremely happy to have you here. And you know you are coming from our sister island, Cuba. Of course, you know that your president, Fidel, always maintained that he's training professionals to save lives. He said at one time he's not training anybody to develop bombs to kill people. What he's doing is he's training his people to save lives. And today this is a very good example of what Comandante Fidel has done for not only for Cuba, but for the entire Caribbean region. And now we are seeing his efforts extending all around the world as we are experiencing this horrible virus that has invaded the globe. So I want to say to you, it is with a lot of excitement and emotion that I look at you here today. And I know the effort, I know the work, I know the solidarity that has gone into you being who you are today, and you coming here to help us in Saint Lucia. I am just so thankful and so grateful, and I thank God for your presence here today because we really need you. We need your assistance, and just the way that you present yourself, it is so professional. I can see that you are here to help us, and now I feel much better about us having the assistance we need to fight this virus. So I want to thank all of you, and always feel free. Ambassador knows that I have an open door when it comes to anybody wanting to see me. I want to say thank you, a special thanks to our ambassador here, your ambassador for Cuba to Saint Lucia. He's always very attentive to our needs. Anytime we ask for help, his support, he's always willing, always ready. We see him as a brother, as a sister. I want to welcome Dr. Lopez back with us today. Of course, he's like staff in our Ministry of Health. Madam Ambassador, I say, thank you very much. I hardly see you in public events like that. So I want to thank you very much for being here. My fellow ministers of government, my staff of the Ministry of Health, I know that my staff is especially relieved that they are going to get assistance from you to continue to do the good work that they have been doing to contain this virus. So without further ado, I'm not going to keep you very long. I know you've come a long way. You need to rest. You need to get out there, get those things off your face. So thank you very much for coming. Vive la Fidel. Viva. Thank you very much.
Thank you, Senator the Honorable Mary Isaac. Now, all of this would not be possible without the involvement and assistance of our Foreign Affairs Department. So at this time, we invite our Honorable Minister of Foreign Affairs, Sarah Flood-Bobra, to the podium.
We are facing an unprecedented time in the world today. A time when we call on our friends for help. A time when every country is facing the same problem. And so we ask, who do we turn to? And we turn to a friend whom we knew would say yes. Cuba. This is not the first time Cuban health professionals have been here. But this is the first time so many have come all at once. Cuba and Saint Lucia established diplomatic relations more than 40 years ago, soon after our independence. And we have come to know the Cuban person. We have come to understand what the Cuban citizen is like. We have come to recognize and know a Cuban by your heart. And so I want to come closer to thank you. As you walked with your masks, we made eye contact, and that said a lot to us. When Cubans come to help, they don't just come to give up their skills. They don't just come to give up their expertise. You come to give up yourselves. Because you're giving from the little that you have, not from the excess that you have. You're here not because there is not a need in your own country. You have as great a need as we have. But you've left your homes, you've left your families. You've come as soldiers on a battlefield to fight a war, and you've come prepared. You've come dressed for battle. And we want to thank you for that. Our health professionals have done an amazing job, are doing an amazing job, led by the Minister of Health, the Chief Medical Officer, the Principal Nursing Officer, and the staff. But this disease needs a big army, a strong army, a united army, an army of friends in solidarity. And that's why we turned to our dear friend, the ambassador, because we knew that Cuba is always Cuba. Never changes. And so we know that you are here to help us and that we will fight this. So thank you. Thank you very much. This is your home away from home, and already with you we know we will be celebrating successes. Cuba.
Thank you, Minister Bobram. I invite the Permanent Secretary within the Ministry of Tourism, Information and Broadcasting, Culture and Creative Industries, Ms. Donnaline Vite, to join us at the podium.
A warm St. Lucian good afternoon to you, especially those of you who are coming in to assist us from Cuba. Good afternoon. And just encourage all of my colleagues and everybody just to put a massive hand for the group here today and for the relationship with Cuba. If there is no time, we understand the importance and the connection, the number of tentacles tourism have, we do so now. We understand that when tourism falls, many other things falls too. And so the Ministry of Health and the government of St. Lucia has been working extremely hard not to allow that fall to be so hard and so difficult. And as we cushion the blow, there are many people who we have to underscore for thanks. For you two, this relationship is amazing to us. Just for the team to be here, our Minister for Tourism, who's unable to be here with us this afternoon, not as its own fault, but really went through lengths with his team of colleagues to make that happen. Tourism really had to come into the play. And so the regional relationship with Bahamas and Bahama Air, we really have to thank the government of Bahamas for making this happen today. Really came into play. And it is really for us to say how important you are to make this happen. The faster Saint Lucia is able and the rest of the world to address this problem, the faster we are able to live as normal, the faster we are able to travel, and so the connections happen again. For the past weeks, the ministry, we have been seeing a rollout, an exponential decline in the employment within the sector. And as of now, there are thousands of people that you are coming to serve. It is not just the government of Saint Lucia, but it's the many households for persons who have been sent home, the many households of taxi drivers, or even persons who work at this airport who have had to be sent home because of this virus that we are fighting. And so we say thanks to you. We say thanks to the providers of your accommodation, Sandals International, who will be housing you, and we are ensuring comfort to you. Yes, I know I see some heads going and say thank you. We are doing that. And of course, you will be overseen by the Chief Medical Officer and her staff. We say thanks. Humility forces you to say thanks, and even on bended knees, but I'll try to do so in Spanish to say gracias and gracias, Cuba. Thank you.
Thank you, PS. At this time, we invite His Excellency Alejandro Simacos Marin, the Ambassador of the Republic of Cuba, to the podium.
This is an enormous honor, pride, and a big emotion for us this moment to receive you here in the sister Saint Lucia. Just 10 days ago, we received the request for support from the government of Saint Lucia. For Cuba, that was the request of a sister country to which we had to extend our hands. As we have always said, Saint Lucia can count on Cuba. Therefore, our government gave this request all priority, and they began to work quickly on the selection of this big group that we are receiving here today. I must say that everything was done in a negative and extraordinary scenario marked by the coronavirus pandemic, against which we are also fighting in Cuba. And in the middle of the worst economic scenario in Cuba, marked by the worst virus, which is the United States blockades against Cuba. The last days has been of intense work in Cuba to accelerate the formation and the preparation of this big brigade. At the same time, I have to recognize and to thank, to express my deep gratitude for the intense effort, for the intense work undertaken by the Ministry of Health, particularly by the Minister, Mary Isa, also by the Ministry of Tourism, and particularly by the Minister, Dominic Fidi, who could not come today. They made all the effort in order to organize all the logistics to take this big group to Saint Lucia, and also to organize everything here in Saint Lucia to receive them in the way they deserve. So my deep gratitude for that. Today we are proud and honored to receive this group made of doctors, nurses, biomedical engineers. They have come from different provinces of Cuba. As you can see, they belong to different generations. Some of them have more experience, some of them less. Most of them are women, which is good. But all of them, they have in common the commitment to work together with the government and the people of the sister island of Saint Lucia in the fight against the coronavirus pandemic. The discipline, determination, and organization that each of these health professionals showed, the speed and the complete disposition in which they responded to this call, they made it possible for them to arrive in Saint Lucia in such a short period of time. I believe that once again we have set an example for those who seek to impose hegemony, blockade, sanctions, hatred in international relationships. In front of them, we have given once again a show of solidarity, love, cooperation, disinterest. This is an example of the South-South cooperation which results Cuba and Saint Lucia have shown for more than 40 years. The women and men who arrive to Saint Lucia today to defeat the coronavirus are the example of the feelings of humanity, friendship, solidarity, and love with which the historical leader of the Cuban Revolution, Fidel Castro, built our relationships towards the Caribbean and towards Saint Lucia. As you can see, they bring our flag, the sacred symbol that dignifies us and that makes us feel proud. But in the coming weeks, in the coming months, the Cuban flag will be twisted together with the Saint Lucian flag in the common effort for the health of the Saint Lucian people. And it will be, both flags will be twisted in the friendship and the solidarity. Together with you in the coming weeks, together Cuba and Saint Lucia are stronger, and without a doubt we will obtain the victory in this battle for the health and the well-being of the people of Saint Lucia. We will work together until we defeat the coronavirus and until the moment we can declare to the world that the hugs, the kisses, the handshakings have returned to the beautiful Saint Lucia. Thanks to you, thanks to the authority of Saint Lucia. Viva Cuba, viva Saint Lucia, always together.
You've just seen the arrival of 113 medical professionals coming to Saint Lucia from Havana, Cuba. I'm Doreen Georges on behalf of the government of Saint Lucia. Thank you for watching.